Good morning. How are you doing? I hope that you're well, you're happy, you're blessed. Karibu sana to MBCI TV, where we transform lives by the grace of God. Thank you so much for being here. Thank you so much for choosing to watch MBCI TV. I hope and pray that you will be transformed in Jesus' name. Amen. It's the 11th of June 2025, one of my most favorite days. Thank you so much for being here, and it's also very favorite because it's on a Wednesday. And that tells you that what you're having on air right now is Afya Clinic, where we talk about everything health, okay? And what we say is that we simplify these topics to make sure that you understand what you're talking about. And, the topic also gets interesting sometimes because, the health topics are not usually very interesting. They're not usually very interesting. So what we do here is that we simplify and make sure that our topics are very easily understandable. So thank you so much for being here. I know that today we're going to have an amazing time. My name is Rachel Kahogo, blessed and happy to be here. We'll be here up to 10 in the a.m. All right? Today we'll be having a nurse who we've had before. She's called Antenatal. And we'll be talking about something very interesting that I will be explaining in a very short while. But for now, karibu sana. Our numbers are very open. That is 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We are live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and on all social media pages are Rachel Kahugu. Kienda pale utaweza kunipata loud and clear. Now, last week, as you know, is that every Wednesday we have Afya Clinic where we talk about different issues. Last week we were talking about Malezi Bora because it was the Malezi Bora week, where the kids, the under fives, walikuwa wanapewa supplements, and just to make sure that as they grow, wanagrow wakiwa healthy. And the Ministry of Health, they took an initiative to educate the public about why it's important for the kids to eat well, to get supplements, to go for the immunizations under 5 years. And you talked about how beautiful it would be or how easy it is to manage everything before 5 years. And you talked about some of the diseases or the conditions that cannot be backtracked. Something like polio. Once mtoto amekuwa na polio, that's it. And we do believe and trust that God is a God who heals. He is a healer. And there are miracles. And we do believe in that. But he's given us doctors for a reason. So that you could take your kid apewe chanjo ya polio, and then atakuwa yuko sawa. And while we were talking about this, we had so many questions. Why do you have to take a child to the hospital every month for 5 years? Surely. And he said that's very important because we get to see the milestones and to know what is delayed, what do we need to change, or what do we need to improve. And because of all those questions, we say that now this week, we'll be talking about the whole journey, prenatal and postnatal. So if you're a mom, you've just either conceived or you've just given birth to your baby, and you need to understand the whole journey, or you're looking forward to being a mom. This is where we get to talk about the journey. What do you do before you get pregnant? What do you do while pregnant? What do you do after the baby, after you've delivered the baby? What are some of the things that you do to make sure that the baby is healthy and to make sure that you are healthy? What are some of the complications that you face through the journey? And how you're supposed to go through it? Or what are you supposed to do to make sure that you don't get the complications? So that is what we'll be talking about today. And to help us handle the topic, we'll be having Nurse Antenatal. It's not the first time amekuwa hapa. Tulikuwa na yeye should be April. And I know that you'll be seeing her in a very short while. But for you to just understand the journey, we have an In History segment that helps you to understand the history of all these. Where did people start learning that you have to get, a nurse or a doctor to take care of your baby? Or when you're pregnant, you don't just go to hospital when you're not feeling okay, that you have to go to hospital each and every month. Mambo yote ilianza wapi? So we get to understand these through the In History segment. As we get to that particular segment, let me just remind you that our numbers are very open. That is 0721 105 105 on WhatsApp, 23814, our SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and on all social media pages at Rachel Kahungu. Ukienda pale, nitaweza kupata ujumbe wako. Talk to us. Apart from all that we've talked about, we'd love to know how you are doing, how your week has been. What are you thanking God for? It's the second week of the 6th month of the year. So that tells you there's so much that we talk about, but tuambie what you're thanking God for. Okay? So let's get the In History segment. As we come back, we'll be coming back to engage with the nurse, but also read your feedback. Usiende mbali.
In early societies like Egypt, Greece, and India, pregnancy and childbirth were largely managed by midwives using traditional knowledge and herbal remedies. These practices were often steeped in cultural beliefs and rituals with little scientific understanding of maternal or fetal health. Despite the lack of formal medical care, the role of community midwives was crucial, and they often provided both antenatal support and assistance during childbirth. During the 18th and 19th centuries, advances in medicine and public health gradually shaped the development of more structured maternal care. The rise of obstetrics as a medical specialty, along with improvements in hygiene and surgical techniques, began to reduce maternal and infant mortality rates in industrialized nations. Antenatal care began to include routine medical checkups, and awareness grew about the importance of monitoring pregnancy for complications like preeclampsia. However, access to such care remained limited for many women, particularly in rural and low-income areas. In the 20th century, antenatal and postnatal care became more institutionalized and evidence-based, especially with the emergence of national health systems and international health guidelines. The World Health Organization and other bodies promoted standardized care practices to ensure maternal and newborn well-being.
All right, so that is what we get on antenatal, postnatal, prenatal. There's a lot of words. Good thing we have a nurse here, and she'll be explaining all that to us. To also just get to understand in details, hizo zote ni nini, all right? And for you to just understand who we are having today, as I said before, is that the last time alikuwa hapa was in April, na amenikumbusha the last time akiwa hapa, I needed help. Nilikuwa na homa, you were not okay. And I remember that time we were talking about, unajua, watu wengi wako na homa, it's a thing. But she said, no, work on your immunity. And we talk about that every time here. I hope that you've been taking good care of your health. I hope that you've been eating well and taking a lot of water. You've been following everything that we are saying. Now, to get to understand who we are having today, we have a guest profile. So let's get the profile, and then she'll be coming back to introduce herself vizuri so that you can hear from the horse's mouth. But for now, let's get the guest profile. Good morning and welcome to Afya Clinic, your trusted health show where we simplify medical topics that matter to you and me. Today, we are focusing on prenatal and postnatal care, crucial aspects of a mother's health journey. Joining us to help us unpack this important conversation is a passionate and experienced health professional, Nurse Antenatal Ajenjo. She's currently serving at Lanet Health Center under the Ministry of Health and brings with her a rich background of having previously worked at PGH Nakuru, Evans Hospital and Optimum Hospital Nakuru. She's deeply committed to community health, and we are honored to have her with us today. Kindly help me welcome on-set Nurse Antenatal Ajenjo. Karibu sana. Thank you for being here.
Asante sana.
So naona nime-improve.
Yes.
Yeah, I've been trying to eat very well. Sijatumia supplements, nimetumia food.
That's great.
Things like that. And a lot of water.
I can see an improvement.
Yeah. Asante sana. How have you been?
I'm good.
Pale Lanet mambo iko aje?
Iko sawa kabisa.
Okay.
Ugonjwa ni wale tu wanasema tusifurahie ugonjwa, but they do come for help. But yeah.
Okay.
Yeah.
What maybe you'll be introducing yourself for the people who are seeing you for the very first time, but before you do that, what is the case that you're handling most right now? Is there an outbreak?
No, we are having the sensitization on mpox right now, and maybe the flu here and there.
Yeah.
But right now we are cautious about the mpox.
Okay.
Yeah.
Okay. We'll guzia kidogo what mpox is, because we tulifanya kitambo, and maybe, you know, just to brush over it. But remember, we talked about it, so if you need to know it in details, ukienda kwenye YouTube, MBCI TV official YouTube page, utafuta to Afya Clinics mpox, utaipata pale. Okay? But for the people who are seeing you for the very first time, please introduce yourself, say hi to them, and then we could get right into the topic.
Okay. Hello, my name is Antenatal. I'm a nurse by profession. I'm a mother. So when I'll be talking about ANC clinics and maybe postnatal care, it is something that I've gone through. So I'll be very confident to talk about it.
Yeah.
And what else? I have passion for nursing. I have passion for people who are sick.
Yeah.
When we see them get better, we know that we've provided the care that they need. Yeah.
Okay.
So I think I'm happy to be here.
Thank you.
And I'm happy to answer all your troubling questions about ANC and postnatal care.
All right.
Yeah.
Thank you so much for being here. There's a question that I love to ask nurses. What is the, I don't love to call it traumatizing, but nipe a better name for it. But today let me just ask most, director, asante sana, most memorable case that you've handled as a nurse.
Okay. Okay, there are so many cases that we deal with, but the most traumatizing one is when you have a patient, someone that came in walking and then they live through the mortuary. It's so sad. And the most exciting part is when you have a patient who's so much incapacitated, getting up after maybe you've taken care of them. That is one of the most joyful things that we get as nurses or as medical practitioners. We get a lot of cases. Some are interesting, some are relieving, some are saddening. But that is how life is, and that's why we are there.
Kuna kwanga, last month we were talking about mental health. Do you guys go for mental health checkups and stuff like that? Because, you know.
Okay, they say mganga ajigangi, but still, our colleagues are the ones who would counsel us. Because when you feel you've had a lot, you can take a leave. You can seek for medical health, of course, mental health, counseling, and all that. So it doesn't mean that if you're dealing with patients who are maybe mentally unstable, you will always be mentally stable. So we also seek for mental consultations at the appropriate time, or maybe we get a break from work for some time.
Okay, perfect. Now today we're talking about prenatal and postnatal care. Maybe let's just start with, you mentioned ANC. Tell us about that.
So antenatal care, we call it ANC, some call it, ANC, some call it prenatal care. It's actually the same thing. But antenatal care is care that is offered to all pregnant women. We offer it to pregnant women from the start, or from the start of their pregnancy to the start of their labor. Because when they reach in labor ward now, it stops becoming ANC. It becomes a maternity issue. And then after maternity, now it becomes a different issue. So antenatal care is the care we give to these pregnant women during their pregnancy, from the time that they realize that they are pregnant up to the time that they go to the labor ward. So we have different types of clients, and at times government used to call it FANC, focused antenatal care. Because clients are different. The way pregnancy will take you is different from the way pregnancy is going to take me. So when we talk about FANC, we are focusing on individualized care to a specific patient. When Rachel comes to the clinic, we are dealing with Rachel and all her complaints, because our problems might be the same. Yes, we might be having common like physiological changes in pregnancy, but it also depends with an individual.
Okay.
So that is why when the government introduced focused antenatal care, it was meant to be customized and individualized according to each client that works in that clinic.
Okay.
Yes.
Okay. And I love that you've mentioned focused, and you've explained that everyone is different.
Yeah.
But maybe we'll be starting with the prenatal, as you mentioned, before you get into the labor ward and everything you need to do there. Yeah. But maybe, since you've said from 1%, pregnancy differs from one person to the other.
Yeah.
But would pregnancy differ on the same person, one baby to the other?
Yeah,
Aba wewe uko tu sawa, your first pregnancy and your second and your third, ukipata the first baby, unajua, this is my blueprint. Yeah.
No, pregnancy is also different depending on, I might have baby one who has not brought me so much complications or so much physiological changes.
Yeah.
And baby two will be different. So pregnancies are also different. Apart from it being different from different people, each pregnancy has its own way that it comes. So the first one, I might be having nausea and vomiting. The second one, I'm having recurrent headaches. So we cannot assume that if I got pregnant last 3 years, this pregnancy will be the same as the first pregnancy.
Okay.
Yeah.
So it differs.
It differs, yes.
Okay. Okay, I see. So now that you've explained what prenatal is, why is it important for the mother and the baby?
Okay. So one, when we do prenatal care, we encourage mothers to make sure they start their antenatal care clinics as early as they realize they are pregnant. So one of the issues that make us urge these mothers to come for their clinics is monitoring their pregnancies.
Yeah.
You know, pregnancies come with so many complications. So we encourage them to come as early as they know for easy monitoring. And we also do assessment each and every time that they come for their clinics. We do assessments.
Yeah.
We also give preventive treatments where we give some drugs that in malaria endemic zones, we give them prophylaxis for malaria. We give them nets. We also give drugs that prevent anemia and prevent abnormalities in babies.
Yeah.
We also give tetanus vaccines. So we give preventive care. As we continue monitoring, we are taking these mothers to the labs. There are some assessments that we have to do through lab works, and then we treat them. So we also give curative care, and we also give health education. We are empowering the mothers so that they know that if I am having these, is it normal? If I'm having these, is it okay? So it is a way of monitoring, getting to curb complications that come with pregnancies, and managing them at the right time. To make sure that at the end of it all, we have a healthy mother, we have a healthy baby.
Okay.
Yes.
I see. So when should the mother start the clinics? When she knows she wanna get pregnant, maybe in the next 2 months, ama akisha realize ako pregnant, ama after like 6 months, uko like, okay, now I think I need to go to hospital.
You see, one funny thing is that you'll never miss a mother who will come for the clinic at the 9th month.
9?
Yes, they
Surely
do come.
month 90 you
and
come
they'll
in to
tell
get
you,
the baby.
mimi nilikuwa nafikiria ni kitu, nimesikia tu kama kitu inacheza. So that is what brought me. But we always encourage
Would you miss
them.
pregnancy though?
Yes, they do.
Let me ask you guys. Wait, would you miss pregnancy for 9 months?
They come at the 9th month.
You don't hear people saying, Atime didn't know I was pregnant. Nikaenda husi nikaambiwa niko 6 months. And I just bombastic side eye. Wacha mchezo.
They do come.
Yeah.
So we really encourage them to start their clinics as early as the first week or the first trimester up to maybe the 12th month. And there's a good way that the government has also tried to make sure that they come for their clinics early.
Yeah.
They've involved the community health workers.
Yeah.
So they go to the communities, actually they know the people around them, and they are able to note the ones that are pregnant. So they encourage them to come for their clinics as early as maybe at 6 weeks or as earliest as they can realize that they're pregnant.
Okay.
So I think right now we are having a good number coming up early. Yes.
All right. Yeah. So now that maybe you've explained that you should go to hospital as early as you realize that you're pregnant, what's the process like? Where do you start? What do you need to do? Or what is usually the first thing you do? Do you get supplements? Because I understand there are moms who go and they wonder, okay, so we're here, tuanze wapi?
So when they come for their clinics, we do history taking.
Yeah.
Through history taking, you're able to note if a patient had maybe a complication in the previous pregnancy. Is there any sickness in the family that might affect the current pregnancy? Okay. So we are going to do clear history taking. We are going to send you for antenatal profile, where we take clear the test that I was talking about. Yeah. We are going to do physical examination of the patient. We get to note, you do head-to-toe physical examination. Okay. We are going to treat you. We are going to give you preventive care. And you're going to also teach you on how to carry yourself during pregnancy and to maybe note if you're having any problems. Okay. So those are some of the care that you give to them. So it's preventive, curative still, and all that.
You've mentioned something, how to take care of yourself during pregnancy. And I know that we'll be looking at some of the myths and the misconceptions later, but what are the basics of what a mother is supposed to do once you realize you're pregnant?
As we are talking about ANC, the minute you realize you're pregnant, I'll still insist that you start your ANC clinics. And then when you come for the ANC clinics, we are giving supplements, the IFAS, it's called IFAS. It is a prophylactic treatment for anemia and maybe preventive of abnormalities in pregnancies. So we give the supplements, and above all, nutrition-wise, we advise them to eat for 2. Yeah. You're eating for 2, for 3, depending on the number of
So eating for 2 is a thing?
Yeah, you have to eat for 2. You also have to rest a lot. Yeah, resting a lot. You should also be able to detect where there's a problem. When you're having maybe recurrent problems, you should not assume them like, this is what all pregnant mothers go through. And then maybe we also discourage them from strenuous activities, like carrying heavy loads and all that, because that can lead to miscarriages.
Okay. Yeah. Okay. You've mentioned about eating for 2. What that already happened. There's something you mentioned the other time when we were talking about malaria, and you said in everything is that you are what you eat. For this mom who's pregnant, she's eating for her and for the baby. So what are these meals and what's the frequency of eating?
Okay, in pregnancy, sometimes because of hormonal changes, an increase in progesterone, you find that sometimes you experience a lot of nausea and a lot of abdominal issues. So mostly we would encourage mothers to take balanced diet, but you find that when you're pregnant, your stomach feels very fast. And then you start having heartburns, hyperacidity, and now it discourages you from eating, or even nausea and vomiting. So we encourage them that when you're eating, yes, you are encouraged to take balanced diet, but you can take it small but frequent. Small but frequent. You see, if you eat small but frequent, the absorption is also taking time. And like when you're eating a lot of food that fills your stomach and you feel full like all the time and you feel nauseated, it's so uncomfortable. So we encourage them to take balanced diet, take a lot of water, take just nutritious food, but you eat it small but frequently, so that you are also able to manage a few of the complications that come with pregnancy.
All right. Yeah. What are these complications or challenges that comes with pregnancy? Of course, apart from what you've mentioned, for what most mothers say is the heartburn and the hyperacidity or the bloating and the gas. Apart from that, what are other common challenges or complications that pregnant mothers face?
So pregnant mothers have different complications. We classify them as minor complications, and we also have the major complications. Now the minor complications mostly are coming in because of hormonal changes and maybe physiological changes. For example, a mother would experience the heartburn and the hyperacidity. We can also experience a patient who's always having nausea.
Yeah.
Ukisikia tu harufu ya kitunguu unatapika. Ukisikia harufu ya perfume fulani unasikia kupuke. So those are some of the hormonal effects that come with pregnancy.
Yeah.
And so because sometimes when you're pregnant, your blood also increases because now we are calling it, there's a way that the blood also increases. We're calling it hemodilution. So this hemodilution also causes anemia. So you'd find that pregnant women come with a low hemoglobin levels. So
your blood increases or decreases?
The way that your heart pumps blood also has to increase. Because we want to circulate oxygen and it has to reach the baby.
Yeah.
So we are having what is known as hemodilution, which causes anemia. So sometimes you'd find normal blood levels in pregnancy is going to go down. And then there are some other clients that will also experience recurrent urinary tract infections. So this one is coming in because the environment in the vagina also reduces. The acidity now reduces, and this predisposes these mothers to getting frequent infections. So you'd find that you're treating today, tomorrow they're coming with the same problems, and the same problems, and the same problems. So, and apart from that, there are so many headaches. We are having a mother who's always having blood pressures that increase, or sometimes it decreases. We are having swelling of the legs and all that. Those, and we also have mothers who are having like craving for certain things that are not nutritionally helpful. So we are calling it pica. Pica or pica.
It has a name.
Yeah. So you just crave for something that does not even, will not even help you.
But was soda and ice cream.
Yes. So or ice. You're walking with
like,
a bottle full of iced water. So so we are getting this because of the maybe hormonal effects. So some of the side effects that, or some of the minor complications that mothers get, we just encourage them, or we reassure them. Everything will be okay. Everything will be okay. Rest more, you see. But there are other complications that are more serious, that need more or further investigations. Like when I'm having recurrent headaches, when I'm having blood vision, when I'm having nausea and vomiting that is very persistent, that I don't even eat anything. So there are some other major complications, and some other conditions also come in when you're pregnant. Like hypertension would just come in when you're pregnant. Diabetes mellitus will come in when you're pregnant, and maybe some of the conditions that we detect on lab works. We test you, we find you're HIV positive. We test you, we find you are having syphilis. You see, these ones are now the ones that we have to look into further, because if we fail to, it's going to affect the mother and the baby in a very negative way.
So what are the conditions that would lead to a mother being given a bed rest or a total bed rest?
Like the most common ones, prenatal bleeding. We're calling it APH, antenatal bleeding. When you're bleeding, actually when you're pregnant, you're not supposed to see blood. That's one of the signs. Actually, that's what brings most mothers. Si kuona damu. So asipoona damu ndio nakumbuka nimemiss periods, nafaa kukupiwa mimba. So the fact is, when you're pregnant, you're not supposed to bleed. So when you bleed, it means that either there is poor detachment to the placenta, or there is just a placenta that has been maybe traumatized, and it is the one that is causing bleeding. So when we detect that, and maybe we find that it is not so much of an issue, we will encourage our mothers to rest. But ideally, even in pregnancy, you're supposed to rest. Yes, you're not supposed to be doing a lot of work. Yes, and the other complications, diabetes and pressure. Those ones we also have to monitor keenly, and we are also going to be giving these clients more frequent visits so that we keep monitoring them.
Okay.
But the one that we mostly put on bed rest is antenatal bleeding.
Okay.
Yes.
Now, there's a balance here where our mothers, and we love them very much, would tell us, usikae tu, you will struggle during delivery. Yeah, usikae tu. And then we've had mothers saying, I was told in hospital, I need to rest.
Yeah.
And we've seen in our day, the Gen Z mothers, what they do is that they would try and do some workouts. So where is the balance there?
Okay, so long as it's not a strenuous exercise, I would encourage a mother to at least do some activities. Yes, you can do an activity that is comfortable with you, because I'm not going to say a specific activity that you can do, because you know, as we said earlier, pregnancies are different.
Yeah.
Yes, I might have been during my first pregnancy nilikuwa naenda shamba, nilikuwa nalima, nilikuwa nabeba maji kwa mgongo. But
hey, but that's quite a lot for a pregnant
there are mothers who do that.
Okay.
Mothers are very strong.
Oh, mothers are very strong. That's something.
Alafu, when now I get pregnant for my second baby, siezi hata osha vyombo, siezi hata turn.
Yeah.
Sasa inabidi sasa nipumzike. So kupumzika tutapumzika, lakini exercise kama kuteka walk is okay, swimming is okay. So long as it's not something that involves you taking a lot of weight once, that can lead to detachment of the placenta. Okay. And actually there's something that I forgot. There are clients that have very weak cervix, where now we have to put in the stitches there. We encourage a lot of rest, because it can lead now to an early bleed, or it can even lead to those sutures letting go. Okay. So resting is relative. Resting is relative, and so long as you don't do strenuous exercise, a walk is not bad. Doing a few activities in the house, so long as it does not affect the baby, is okay. Yeah. Yes.
So it differs from one person to the other. You have to know what works for you.
Yes, and it also depends with what condition you're having. Yeah.
Okay, I see. Now, we talked about what you need to do to maintain a very healthy lifestyle as a mom. But also, maybe this would be important, and we'll talk more about it when we're talking about the postnatal and after you've gotten the baby. What is the most important, I think, called supplements for the moms, for the prenatal? Yeah. What are some of the most important supplements that you have to get as a mom, and at what month?
Okay, for the supplements, it's good we start them. That's why we even encourage them to come. We have one that has ferrous, and it also has folic acid. Okay. So the government has put it as a combination to make it easy for the mothers to take the drugs. Okay. Where you see, when you're having like two tablets, taking them might be hard, especially when you're pregnant. It comes with a lot of nausea and maybe. So it's a combined pill. It has both the ferrous and it has folic acid in it. So this one, it helps in prevention of anemia. It also boosts the blood levels. It also prevents neural tube defects, the abnormalities that we might develop early in pregnancies. So we encourage these mothers to come for them. So the IFAS, we are going to give them, and we also give them health education. And then maybe in malaria endemic zones, we give them preventive treatment for malaria. Yes.
I see. Perfect. And maybe would you have the statistics of what are these malaria endemic zones?
See, the coastal region, the river-based, the Kisumu, and the western part of Kenya mostly, and the river-based, the lake-based regions, we find that they breed a lot of mosquitoes. And so those are the common places that you would find we are preventing mothers from getting malaria. In Nakuru, we don't give them the prophylactic treatment for malaria.
Oh, really?
We don't.
Okay.
We don't even give the insecticide-treated nets.
Okay.
Yes.
Oh, because it's not, malaria is not as much.
It's not as much.
Okay.
But if we get mothers who are having malaria, we treat them.
Okay.
Yeah.
I see. Now, let's get some of the vox pops to get to just hear what people have to say about, antenatal and postnatal care. And if you think it's important, so that we know where we need to put more efforts, yeah? If we need to do more of, is it teaching for the public? We need to do more education. But for now, let's just get to learn what you know about prenatal and postnatal care on the vox pops.
First, talking about antenatal care, we look at the mother's pregnancy and we take care of both the mother and the unborn baby. So we first look at the mother's conditions, we look at the blood pressure, we look at sugars, we look at so many things that encompass the whole health of the mother, so that as the unborn baby grows and develops in the womb, the baby gets all the nutrients that he or she needs, and the baby grows in such a nice way so that the pregnancy is smooth, the delivery is smooth, and also the postnatal care. We need to look at the mother's mental health, the mother's physical health, so that she can also be able to take care of the baby, so that this baby may grow well, may get the milk from the breast, may get just a wholesome care, so that these two persons, the mother and the baby, just grow into a healthy way, and we get wholesome people in the society, and we don't lose lives, we don't get sickness, we don't get disorders. All of this can be prevented when we first get the antenatal care. When the mother, whenever she discovers she's pregnant, goes to a nearby clinic so that everything can be checked and her pregnancy just goes on smoothly. Yeah.
Uzuri wa kwenda clinic ukiwa mjamzito ni ya muhimu sana, kwa sababu kuna magonjwa huwa inatokea wakati wa ujauzito, na pia kuna miezi huwa inafikia, lazima huyu mama aende clinic apate chanjo kadhaa za kumzuia yeye mwenyewe na ujauzito wake. Kwa mtoto, ile kinga unapatia mama ndio inakinga mtoto. Kwa hivyo ile chanjo mama anapata kwa clinic inapita kupitia kwa utumbo wa mama na inalinda ule mtoto kutokana na magonjwa mbalimbali. Amejifungua ni muhimu sana kwake na mtoto, kwa sababu kuna madhara hutokea baada ya kujifungua. Kwa hivyo tunafuatilia kwenye clinic, tunapima mama, tunapima mtoto, tunachunguza kama kuna ugonjwa yoyote mtoto anaweza kuwa amepata, ama mama mwenyewe kutokana na baada ya kuzaa kuna jambo lolote ameshuhudia tofauti na vile alivyokuwa. Sasa kuanzia hapo tunachukulia hiyo mkakati kulinda mama na mtoto.
As a mother or as an expectant mother, you are supposed to visit the clinic actually. Immediately you realize that you are pregnant, you are supposed to visit the clinic so that you find out if you are okay or the child is okay or the fetus is okay. If there is any complications, then you need to be diagnosed immediately so that they realize what the problem is, so that they can see how to handle you as a mother and how to handle the fetus. Or maybe if you've started it, maybe later after the child has been formed, they will know how to manage this child. Postnatal, you are supposed to visit the clinic. Actually, as a mother, again, you are supposed to find out if you maybe during the delivery time you had complications, and if you had complications, then you need to visit the clinic so that they can take care of your womb and your health at large. Then second to that, again, for the child, you are supposed to take the child so that they can see whether the child has a problem or the progress of the kid. They weigh the weight and other things concerning the child.
ndio ajue hali yake, ajue pia venye anaendelea, na pia hali ya mtoto mwenye ako naye, na pia mtoto mwenye ako kwa tumbo. Baadaye pia najua sasa akijua venye anaendelea, baadaye ndio atakuwa vizuri. Akikaa hivyo bila kujua, inaweza uwezi jua shida ambazo zinaweza tokea, ambazo zilitokea nyuma, ambazo tena zitaleta shida kubwa mbele.
Perfect. Now there's a lady who, we jump before the drums. We go ahead of ourselves to talk about the mental state of the mom, which is very important, and we'll talk about it, but maybe just comment kidogo about that.
Okay. Pregnancy, to some, it's a very beautiful thing.
Yeah.
Yes. Especially where you maybe looked for a baby for quite a while and you've not gotten, and then you realize that suddenly you're pregnant. But to some, it might come as a bad news, or maybe it comes at the wrong time, you see, and you're left casting. So we have different mothers coming to the clinic with different perception of their pregnancy. So when they come, and it also comes with mood swings. Yes. So a mother would come, the way you're attending to them, you learn to know, this one, she's happy, this one is not, you see. So pregnancy, as we say, it affects mental health, because maybe the physical signs that it also comes with, and there may be some of the minor complications that it comes with, it troubles your mind. You don't even know how food tastes at times. Sometimes the food that you like, suddenly you don't like it, there's some smell so it's affecting your stability with living with others, or even accepting some of the things that come to you. So I would say it can mentally destabilize a patient. So we also try as nurses, apart from the nurses that are in the antenatal clinic, we also have counselors who do counseling. And sometimes when maybe you do some of the antenatal tests that we are doing, and the results come out as what you did not expect, you still need counseling. You're tested for HIV, you find that you're HIV positive, and you came in knowing that you're HIV negative. That is going to affect you for a very long time. You need counseling. You find out you are having syphilis, you need counseling. So as pregnant women, generally the mental health has to be looked into. And that's why when the nurses who work in antenatal clinic are trained to be counselors. A nurse is a counselor. They can still counsel a patient and bring them back to maybe a state that they are feeling a little bit better than I came in. So we also do mental health. We talk to this client, get to know what is going on. Sometimes where we come from, I had a boyfriend, then suddenly boyfriend doesn't want me to. He is telling me to abort the baby. I was living with my parents, then my parents have told me to go look for her. So we have very many aspects of psychological instability that we have to look into when a patient walks in that room as a pregnant woman. So yes, mental health matters a lot when a mother comes in the clinic to seek for antenatal care. So it is part and parcel of the care that we give in antenatal clinic. Yes. And
would a mom who's not mentally stable or mentally well, would that translate to anything health-wise?
Yes, if I'm not mentally stable, even taking care of myself becomes a problem. You'll give me those tablets, I'm not going to take them. Because maybe I'm so depressed, I'm having a lot, I would feel like wacha tu nikufe. Hiyo kenye inanisaidia wacha tu basi nisifanye ndio nikufe haraka. So it is actually going to affect the general health of a pregnant mother if we don't look into the psychological matters that is affecting the mother. So if it destabilizes the mother, it's equally going to destabilize the baby too. Yes.
Okay. Perfect. Now let's get the second part of that, which will be our last part of the Vox Pop today.
Importance in antenatal, first of all, is the moment tu umejua uko na mimba ama umesuspect uko na mimba, you're supposed to go to the hospital. One, for example, nitaongelea story ya HIV. Maybe if a parent has a HIV, inaweza saidia mtoto kukusaidika asicontract the virus. And then kuna hiyo care yenye mama huwa anatakiwa through. Kuna hizi folic acid zenye unafaa kukuwa na meza yenye nakusaidia na ions and such things for the growth of the baby. And also inasaidia kama kuna hizo shindano unafaa kuwa unadungwa kusaidia pia mtoto kuprevent mtoto kuzaliwa na some deformities and such. Na pia inasaidia mama when you have some challenges, itakusaidia. Postnatal care inasaidia pia mtoto, ukizaa mtoto unafaa kuwa unapeleka mtoto clinic. Kuna chanjo mtoto anafaa kuwa anadungwa ya kuprevent hizo ulemavu and such things. And pia inategemea umedeliver aje, normal, CS. So kuna hizo cares pia zenye unasaidiwa, because hapo ndo unapata mama anaweza contract at infections in one or another. So there's a lot of cares that it's supposed to be taken for these two people, that is the baby plus the mother, to grow in a safer way.
So when we talk of antenatal care to a woman is like you are caring for the mother and the baby at the same time. And through this we are able to know, or we are able to defend things like maternal and fetal death at the same time. Then we are also able to know the fetal growth throughout the pregnancy period. That's for antenatal care. Then postnatal, not prenatal, postnatal. So for the postnatal, that's now, then the mother is done with the clinic, the mother has delivered the baby, now she's at home, but we still encourage the mother to come to the clinic. So while the mother will be able to come to the clinic, we'll ensure this ensures that the growth of the baby, the developmental of the baby is seen, whether is it to the right standard or not. At the same time, we'll have to know whether, for example, the mothers usually go for CS. We see where the tear was repaired well, something of that kind, and from there we'll be able to know the condition of the mother.
Inakuwa muhimu kwenda kliniki ndio mtoto aangaliwe kama amekaa mzuri, hali yake na hali ya mama. Na baadaye inakuwa hata mzuri ndio akipeleka mtoto anaonekana kama anaenda mzuri au anaenda chini, na hata mama anaangaliwa kama ako poa.
Tutaanza na estimation of the birth date of the baby, and also kuna risks that pregnant women have when they are carrying the baby. So we check for that, any condition that you might have that can be transferred to the baby. We also prepare you psychologically for the baby. We check for diseases like HIV, syphilis, anemia, TB that might affect you and also the baby during the conceiving period. We also provide advices on the things you should be taking, like folic acid, the vitamins you should be taking, and just general support of the baby. It is very key, and a woman should have like at least 8 of the visits before giving birth.
Umuhimu wa mama kwenda kliniki kabla ajifungue ni kwenda kuangaliwa kama kunaweza kuwa na ugonjwa yoyote ambayo inaweza kuwa imempata wakati alikuwa ako na mimba, ambayo asiambukize mtoto. So ni vizuri kuzuia ni bora kushinda nini? Kushinda tiba. I think ni vizuri wa mama waende kliniki waangaliwe na kwa afya yao na kwa manufaa ya mtoto.
All right, so we are back, and absolutely love how most of the people who are there, they have knowledge of what they're saying. You can tell they have the idea. Even the men, which is a really beautiful thing. Yeah, because sometimes you get the men who can be really clueless about things to do with pregnancy because they're like, hey, I mean, but I love that for the people who we've talked to today, you can tell they know a bit, they know something.
A lot.
They know a lot, actually. Oh, they know a lot.
They know a lot.
Which is really beautiful.
Yeah.
Now, that is it about that. Auntie D, mambo ya rhesus factor. Tell us about it.
So when these mothers walks into the clinic, we are doing the ANC profiles.
Yeah.
So the ANC profiles we're doing, there are very many. There are some tests that are specific to pregnant women. We are going to do the levels of your blood. We are calling it HB levels. We are going to check the blood group. What is your blood group? Yeah. So once we find your blood group, we are checking the rhesus factor, a protein that is attached to your blood group. We are calling it the rhesus factor. Most people are rhesus positive, and some or a few percentage of mothers are rhesus negative. And that is where now this thing is coming in. So when we find that a mother is rhesus negative, it means that you do not have that protein that is attached to your blood group.
Okay.
So this one...
Maybe before you continue, in layman's language, the rhesus negative and rhesus positive is the people who would be, say, B positive.
B positive.
Or a few who are usually B negative.
Yes.
I've actually never seen someone who's B negative, come to think of it, but hey. Okay.
So when we say you are rhesus negative, inamaanisha wewe uko na blood group ya negative. Ile ya kila mtu ya A positive, O positive, AB positive, wewe hauna hiyo. Wewe uko na rhesus negative, meaning that there is a factor that is missing in your blood group, which is okay. Haina shida. So the problem now comes in when you are pregnant, you're a mother, you're having a rhesus negative blood group. Then your husband is a rhesus positive person. And then now, unfortunately or fortunately, your baby takes your husband's rhesus. You see? Your husband is rhesus positive. So your baby takes the blood group of the dad, or he's taking the rhesus factor of the dad. So your baby is B positive, and you, as the one carrying the baby, you are rhesus negative. You see? Now, that is not a problem if it's your first pregnancy. It's never a problem. Your baby will be delivered normally. Your baby will not have any problem. But now, the problem comes in the subsequent pregnancies.
Why is it that for the first pregnancy is usually not a problem?
Because there is something called isosensitization. You see, once you've delivered, or maybe you've had abortion, it's the first pregnancy, you've had abortion, your baby's blood, the rhesus positive blood, is going to go back to the maternal circulation. And then the maternal antibodies are going to detect that as an enemy. So they are waiting for another enemy to come. So next time you're getting pregnant, we are waiting for that enemy. And if in the second pregnancy, this mother gets pregnant again, and then the baby takes the rhesus of the dad, now the enemy is here. So the antibody starts...
So it's like a reminder?
Yes. Yes. So the antibody starts attacking your baby. So to reduce this isoimmunization, we advise pregnant mothers to go for an injection called anti-D. It desensitizes the maternal circulation. So once you've given birth, we give you the anti-D so that the circulation of the mother is not reminded of that thing next time you get pregnant. So when we give you an anti-D, it's not meant to protect the current baby, but to protect the subsequent pregnancy.
Okay.
And this injection, you're giving it at 28 weeks. of pregnancy, that is 7 months of pregnancy.
Okay.
We are giving it at 36 weeks of pregnancy, that is approximately 9 months, we say, and then 72 hours after you've delivered, within the 72 hours after you've delivered. So ideally, you're supposed to be taking 3 injections.
All right.
But sometimes, because this drug is very expensive, you'd find that some clients would wait until they deliver, then they are given the anti-D, which is not appropriate, but what do we do? Yeah, because if a mother insists that I don't have money, what do I do? And yet it's not provided in the hospitals that we are currently having. So we advise them to plan for such. So this anti-D, some people call it Rogam. It is the one that is going to desensitize the maternal circulation. So anti-D can be given if a mother has miscarried. Still there is going to be sensitization, because as we lose pregnancy, the circulation will be sensitized that there was an anti-D baby here. So after miscarriage, you're supposed to be given. In cases of some procedures, there's some procedures that are very invasive that can lead to a patient bleeding at the placental site. After we've done such procedures, a mother has also to be given anti-D. And most commonly, the mothers that carry their babies to birth, to term, we have to make sure that they have the anti-D injection. So that when they give birth, we can have a complication of babies born with very major complications. Some of these mothers lose their pregnancies. Some of these mothers give birth to babies who have very bad complications. We are having a condition called hemolytic disease of the newborn. Yes, which destroys the blood of the baby, and then it causes a lot of complications. So to prevent all this, we advise them, the anti-D mothers, the rhesus negative mothers, we are advising them early enough so that they prepare for the anti-D injection. Yes.
And, you know, I see our time is up. We need to go for a break, but maybe in a minute. Would this also occur to the mothers who are rhesus positive, but the dads are rhesus negative?
No. It's only specific to rhesus negative mothers who have babies. Because if my baby carries my blood group, it's okay. If I give birth to a baby who's rhesus negative and I'm rhesus negative, there's no problem. If I'm rhesus positive and I give birth to a baby who's rhesus negative, there's no problem. Yes. But if I'm rhesus negative, I carry a baby who's rhesus positive, that is where the problem comes in. Yes.
I see. Now, we're taking a very short break and then we'll be coming right back. So just to remind you that this is Afya Clinic, where we talk about everything health. And you're getting us from MBCI TV, where we transform lives by the grace of God. So we'll be taking a very short break. As we come back, we'll be coming back to read some of your feedbacks. And we talk about the postnatal. We've talked about the antenatal or prenatal care. If you have any question about the same, please feel free. Our numbers are very open. That is 0721 105 105 on WhatsApp 23814 or SMS code, which is absolutely free of charge. We're live on Facebook on MBCI TV Facebook page. We're live on YouTube on MBCI TV official YouTube page, and on all social media pages are Rachel Kahogo. Sindembali will be coming right back.
MBCI Television, transforming lives.
On your screen. The Lake Olbolosat Half Marathon, June 15, 2025. Run for nature, run for conservation, run for our future.
Are you ready for spiritual awakening? In this month of June, the Wailing Mothers and Pastors' Wife Fellowship Kenya Nyeri chapter invites you to a transformative conference, the Wailing Prayer Feast 2025. 21 days of prayer and fasting at Kamukunji Grounds, Nyeri, commencing on 8th to the 29th of June. Experience divine healing, embrace total restoration with a dynamic lineup of God's generals, including Dr. Lucy Nganga.
They are not like Joseph. Joseph was thrown born in a foreign land, but he had self-government and rule.
Mama Ada Adoyo.
He pointed at a mountain and said, this is the one I want.
Pastor Julia Karanja.
Contend for your priesthood.
Reverend Evans Chumo.
Watu ambao hawajui kushindwa ni watu walio na majozi.
Pastor T. Mwangi.
You can be young and full of God.
Reverend Mike Bitok.
Your mind is managed by the renewal of the word.
Prophet Paul Moneki.
May God give you more than internal womb.
Apostle Julius Subi.
Certain things will take place in the heavens that will affect the earth.
Apostle David Juma.
Lazima God atapreserve kamondo moja.
Apostle Andrew Nganga.
But when we are prayerless, we become subject to the environment.
And Prophetess Winnie Andrew.
For maono is survive, there must be midwives who will preserve through prayer.
We gather under the powerful theme, positioning a generation through intercession, inspired by Jeremiah chapter 31 verse 15. Don't miss the powerful proclamation march on June 28, culminating with a powerful climax worship rally on June 29th at 2 p.m. Daily sessions, that is morning devotion from 5 a.m. to 7:30 a.m., morning session from 9 a.m. to 11 a.m., lunch hour from 12 p.m. to 2 p.m., evening service from 3 p.m. to 6 p.m., Saturdays from 9 a.m. to 6 p.m., and Sundays from 2 p.m. to 6 p.m. Boarding at only 150 Kenya shillings per day. Pay via M-Pesa till number 4462620. For more information, contact 0720-674-404. Welcome and be a part of this generational army.
MBCI Television, transforming lives.
All right, we're back after that very short break. Karibu sana, thank you so much for staying. This is MBCI TV ambapo tunabadilisha maisha by the grace of God. And of course, the show on air is Afya Clinic. Today we talk about mambo ya health. And we're talking about your pregnancy journey as a mom. As you get pregnant or while you're pregnant, during the labor room, hapo ndo maneno tulembwa inakuanga, and it's usually very different for everyone. But we've been told the pregnancy journey is also very different for everyone and unique. Every pregnancy is also very unique. But we are back and we'd love to talk about the postnatal. After you've gotten your baby, how to take care of yourself, how to take care of your baby. And maybe the best place to start is for the mothers who unfortunately get the PPH. I don't want to say it in full because I might just say my things. So please explain what PPH is and then tell us what causes that.
Okay. So PPH is postpartum hemorrhage.
Okay.
Yes.
So is it hemorrhage or hemorrhage? I mean, I depend on mahali ulienda. Okay. Postpartum that.
Hemorrhage, yeah,
yes.
that. Postpartum hemorrhage. Now this is bleeding after delivery. If you had a normal delivery, we call that PPH, postpartum hemorrhage.
Okay.
Then we can also have mothers who have delivered through cesarean section. They can as well experience PPH. So when we measure the amount of blood that is coming out more than 1,000 mils, that is 1 liter of blood.
Yeah.
Is it? 1,000
Yeah.
is 1 liter.
Yeah.
So that is still PPH. And then we have people who can still experience, we might experience PPH, most of PPH is experienced immediately after delivery.
Yeah.
But some people would still experience maybe PPH after some days or some hours after delivery.
Okay.
You might have delivered a mother, you take her to a postnatal room, and then you realize that she's bleeding after maybe 2 hours after delivery.
Okay.
Especially, this one is very common in cesarean section mothers. They are moved from the theater. When they come to the ward is when you realize, oh, this mother is bleeding. So postpartum hemorrhage is very deadly. It can kill a mother within seconds if prompt treatment is not taken into. So what mostly causes postpartum hemorrhage, we are calling them the T's, trauma to the vaginal canal during delivery, when the baby was coming out, there were tears. There was an episiotomy, a cut that was given through at the perineum region, and it was not sutured well. It's bleeding.
Okay.
Another it could be tissue, where a mother delivers and there are some products of conception that have remained inside the uterus of a mother, if it's not well cleaned. So that is why after delivery, we have to make sure that the uterus is well contracted. We can also have a patient who has maybe a thrombi, just some tissues that get into the circulation and causes a lot of bleeding.
Okay.
So PPH comes in when the uterus is not well contracted.
Okay.
If it is not well contracted, we are going to have the blood vessels that are bleeding. Because where the placenta was coming from, there were blood vessels there. And when it comes out, there are those bleeders that are left. So we have to make sure that this thing is well contracted so that a mother does not bleed.
Okay.
Yes.
Okay. So how long should the mother keep coming for checkup after delivery?
Actually, they say that postpartum care should take up to 6 months, but as we said, individualized. The minimum of 6 months. And so 6 weeks, up to 6 weeks.
Okay.
So we see mothers, after the mothers have delivered, we have to stay with them in the ward for about 48 hours after delivery, so that we monitor them for any complications.
Okay.
But if you're done CS, it might take a little bit longer, depending on how you're healing. So 48 hours, and then we give you a return date of 2 weeks. You're coming back after 2 weeks for normal checkups. We are checking if the suture is healing. Are you breastfeeding well? Is your baby okay? And all that.
Okay.
Then after 2 weeks, we give you another return date at 6 weeks. So as you bring your baby for immunization, you're also going for checkup as a mother.
Okay.
But postpartum, we can even extend it up to 6 months. Yes.
Okay.
So long as we are having issues, we can still extend it.
Okay.
Yes.
So
up to 6 weeks is okay, but we can prolong it up to 6 months.
Yes. And you said it's very important for the mom as well. You know,
very important.
I had a conversation somewhere where people are saying that most time you don't check up on the mom. After the baby is born, all the attention shifts to the baby. And you forget that you have to take care of the mom as well, which is very important. And you mentioned about the mental health part. Let's talk about the postpartum depression. So what are some of the causes of postpartum depression, apart from what you mentioned, that maybe you aren't planning for the baby and she or he is here and you're wondering, hey,
what do I do?
What do I do? Of course, that we pray if you're there. Pray that you'll get peace in that, and babies are blessings.
So psychological issues in after delivery will come in different ways. It can start as blues. Blues can be experienced even with people who are expecting their babies. Yes, because especially the mothers, the first-time mothers. Yes, you are expecting your baby, but no one told you that if you deliver, you're going to have sores in your perineum. You're not going to be able to sit properly if the baby gave you a tear. You're not going to pass urine peacefully the way you used to. So it comes with a lot of discomfort that is going to destabilize you. No one even told you that if you breastfeed, you're going to be having stomach aches. No one told you that
you have stomach aches. Okay.
No one even told you that if you breastfeed, your breast might become sore. Or you're going to have a lot of milk in your breast that even breastfeeding becomes so uncomfortable. So it comes with blues, just the general mood swings, anger. You see, feeling that you are letting down someone or someone. So you are not stable mentally. And then if the blues are not addressed, it goes to depression.
Okay.
Because now you are having a baby here who's crying. You have a cesarean section here which is hurting you. You cannot turn. You are not able to eat, especially when you are from CS. You're told to wait until after maybe some few hours, then you start eating, you're feeling hungry, you see. So you get into so much of a lot of things in your mind that from the blues, you now go into depression.
Okay.
Then there are people who have mental issues, even when you're pregnant, even during your delivery. If you're not taking your drugs well, and plus all this stress that comes with delivery, you're going to go into what is known as postpartum psychosis.
Okay.
So it's a process that one leads to another, until it reaches mahali sasa mtu atana ruka akili, unaanza kuona, you start hallucinating, you start feeling like mimi afadhali nikalie mtoto nikufe na tukufe sisi wote, you see. So such, but blues wakati inakuja, it might look normal, it just needs assurance and being close, or even putting wale watu wenye mgonjwa ako close nao, akae nao waonge, it goes away.
Okay.
But sasa ikianza kuprogress, na itafika mahali we have to involve a psychologist ama a mental health practitioner akuja aone mgonjwa.
Okay.
Yeah.
Oh, okay. So from what I'm getting is that you have to bring people who are allow
a support
system.
Yes, support system.
So allow the mom to speak out.
Yes, and to understand that siwezi turn, nisaidie, nishikie mtoto. Unaona? Nipanguzie mtoto, mtoto mchenjie diaper. You see? When you have someone mwenye anakusupport hivyo, it becomes very easy. But when you're alone, with all the soreness that you're having, plus the baby who's crying here, ujui hata analia nini. See?
Yes, that is key.
It brings a lot of instability kwa akili ya mgonjwa.
Okay.
Yeah, so mental health is very key in postpartum mothers.
All right.
Yes.
I see. Let's get to look at some of the myths and the misconceptions that surround pregnancy, right from prenatal or before you even conceive to what it looks like for mothers who are pregnant. So as we look at these, please also tell us what are some of the issues or some of the myths that you've had that you'd want to share. Our numbers are very open for that, and we'll be going through it. So the first one is that exercise is dangerous during pregnancy.
We said we must exercise. Lazima tu exercise so long as si ile inaumiza, si strenuous.
Okay.
Mama anafaa kutembea, afai oshe vyombo, atembee kidogo.
Okay.
So exercise is okay in pregnancy.
And how is it that our moms, kitambo, they used to do extreme workouts? I was talking to a mother yesterday, and she said during her times, oh my goodness, walikuwa wanaenda shamba, wanalima, wanabeba, like superheroes.
Wanafanya kazi, kuna moms wenye wanafanya kazi.
What's the difference? Because, their time looks like that was very normal, and our time, we have mothers who are getting bed rest at 2 months, 3 months. Yeah.
So I would still say that this thing depends. It depends. Naweza kuwa hiyo mimba ya kwanza nilikuwa nabeba vitu mingi, lakini sasa hii mimba imekata.
Okay.
Kama imekata.
Yeah. Okay. All right. On to the second one is that pregnant women should eat for 2. Yeah, you've mentioned that.
Yeah. You're eating for 2, you're eating for 3.
Yeah.
You're eating for 4 if you're carrying triplets. So long as you don't eat a lot of meal at once, you can eat as many times as you wish.
Okay.
So long as it's a balanced diet.
Okay. And maybe this is a good place to clear the air on a question that was asked yesterday somewhere. The blood of the mother and the child, is it the same? Does it mix at any point? No.
It doesn't. The baby has their own circulation, and the mother has her own circulation.
Yeah.
So the mother will just transport oxygen to the baby and maybe glucose, but not blood.
Okay.
And that's why it's very safe for pregnant women who are HIV positive to carry their babies and not infect them with HIV.
Yeah.
So long as they are on treatment, your blood will not come in contact with the babies. So your
Okay.
baby is still safe.
All right.
Yeah.
I see. On to the third one is that morning sickness only happens in the morning.
No.
No, it's the look after that statement.
No, morning sickness can occur anytime. We said
Yeah.
what causes, I don't know who came up with the name, but it's because of we said that most of this nausea, vomiting and all that is coming in because of hormonal imbalance.
Yeah.
We are having a lot of, it's called progesterone. It's
Mm.
increasing and causing a lot of issues.
Yeah.
So it can come at any time. Yeah.
So whoever came up with that name of the morning sickness, but why is it usually mostly for most moms in the morning?
I think that's because maybe the levels are very high in the morning.
Okay.
But it doesn't mean that we are only going to experience these signs in the morning. Yeah, we can experience them some other time, but mostly it occurs in the morning.
Okay.
Yes.
I see. And the last one is that you only need to go, that you only need to go for antenatal checkups when you feel sick.
You come to the antenatal clinic so that we know if we detect any sickness early.
Yeah.
So coming when you're sick, that might mean that maybe it has reached a level that it has made you walk into a clinic.
Yeah.
Then maybe that is not good. So we prefer that, as we said, as early as you realize you're pregnant, you're supposed to come to the clinic.
So go get checked mapema.
Mapema.
Cha kungoja mpaka wewe ni mgonjwa ndio unaenda hospitalini. Surely. Okay. Now, what are some of the complications that mothers would face after delivery?
After delivery, the one that we mentioned mostly, the first one, postpartum hemorrhage.
Yeah.
Yeah. Bleeding that can lead to death. Not even, if it's not early managed, we lose mothers through PPH.
Yeah.
Yes. And then we can also have pressure that is increasing even after delivery, hypertension after delivery.
Okay.
We are having mental instability, psychosis, depression.
Yeah.
We are having mothers who would also have mastitis, which is very common. Engorged breast, inflammation of the breast tissues because maybe you're not taught well how to breastfeed or you're not breastfeeding your baby well.
Yeah.
We can also have babies, apart from even the mothers, the babies also have other complications that come after delivery.
Yeah.
Yes.
Okay.
You can have a baby who has stress breathing because the delivery was very hard on them. Or maybe they overstayed during during the delivery process.
Yeah.
So they came out with difficulty breathing.
Okay.
We can have babies who now have a lot of bilirubin, jaundiced babies. Yes, they're just born with the jaundice. Or
Okay.
just during that trauma, we are having babies who are having injury to the head. Yes, so postpartum comes with a lot of complications if you are not well taken care of.
Okay.
That's why we still insist that these pregnant mothers must deliver in a hospital where they are skilled practitioners.
Yeah.
Yes.
Okay. I hear you. Now we're having questions coming in, and maybe we can just look at 2 questions and then we'll be getting the healthy living segment. And the first question you're having is that, so when do you start counting your pregnancy journey?
Once you realize you're pregnant, still insist. Yeah, once you realize you're pregnant, the signs of, you see, nowadays people are so informed.
Yeah.
People they even know better than you. Sometimes they just come to just assess do you know what I know? Yes, but mothers are well informed.
Yeah.
Just knowing that or realizing that you're pregnant, it is good you start coming to the clinic. Even if it's at 4 weeks, 2 weeks, just come.
Okay.
Then we give you the prophylactic supplement. Early enough.
Okay.
Yes.
So for this mother right here, she's asking, how do I know that nimekuja nikiwa 2 weeks or 3 weeks pregnant. How do we get to know that, my baby is 3 weeks or my baby is 2 weeks? Is there a way that you're able as a nurse to know that your baby is 1 month or 2 months?
Okay.
Yeah.
So during the history taking, there are questions we ask them. Your last menses, when did you last see your periods?
Okay.
Then from there, we are able to calculate and to know. And we also do physical assessment. You might tell me that your baby is 4 weeks old, but when I assess you, I'll realize that your baby is 20 weeks old. So we are going to do the calculation, gestational calculations.
Yeah.
We are going to do physical assessment. And if the two are not working together, we're going to ask you to do an ultrasound.
Okay.
So there are so many ways that you can detect
Okay.
the age of the baby.
Yeah.
Yeah.
All right. We had a mom who was asking, maybe it's just right for me to get the question. Yeah. Here she is. Now, we'll be giving the contact to the nurse after we're done, and we'll make sure that you need any help, you'll be able to get the help. So you're asking for the contacts. We'll make sure we do that. But you have Anne, who's saying she's been trying to get pregnant for 2 months, but she's not able to conceive. And she's asking what could be the problem.
Okay. For one to get pregnant, it involves a lot. Then your partner, that could be an issue too. If your partner is not there with you. You see, sometimes your partner is working in a different place and he only comes maybe once in a month.
Yeah.
So maybe he comes during the time that you're not fertile enough to get pregnant. And maybe apart from that, it could be because of some hormonal issues here and there. So sometimes it's good, maybe you've tried all those ways and you see it's not working. It's good to visit a gynecologist so that he can also give you the views and get the tests that will help him know where the problem is.
Okay.
Yes.
Okay. So as we'll be giving your contacts, if you need any more explanation or help, you'll be able to reach out. And Oliza, how long does it take for periods to resume after delivery?
Okay. Now this one is also different. Ideally, after delivery, your hormones should be able to come back to their normal state.
Yeah.
But you see, there are some people, due to maybe breastfeeding, you'd find that some mothers would even extend up to a year or a year and a half. But in most patients, you're going to get it after 6 weeks.
Yeah.
A mother is able to resume back her menses.
Okay.
So this also depends with every individual.
Okay.
Yes.
Okay. Now, we'll be reading more questions as we come back. And maybe just to remind you is that our numbers are open and ready to receive your questions. That is on WhatsApp 0721105105 23814, our SMS code, which is absolutely free of charge. You'd reach out through our Facebook page, which is MBCI TV Facebook. We're live and we'll be able to get your feedback. And also on YouTube, we're live tuko pale, and that is MBCI TV official YouTube page. For now, let's get the Healthy Living segment by Sylvia Wanja. We'll be able to go through it and learn a thing or two about living a healthy life.
Antenatal and postnatal care respectively refers to the healthcare provided to women during pregnancy and after childbirth. These services are essential for ensuring the health and well-being of both the mother and the baby. Antenatal care is also referred to as ANC, and it helps in monitoring the health of the mother and the fetus, detect and manage complications early, for example gestational diabetes, provide health education and counseling, prepare the mother for delivery and parenthood, and also promote a healthy lifestyle, for example nutrition. Expectant mothers are advised to have a minimum of 8 ANC visits for positive pregnancy experience. Postnatal care is also referred to as PNC, is the care given to mothers and her newborn immediately after delivery and during the first 6 weeks of life. It helps in ensuring the recovery of the mother after childbirth, detecting and managing complications, for example postpartum hemorrhage, support breastfeeding and newborn care, and also address maternal mental health. Antenatal and postnatal care reduces maternal and infant mortality, and it also helps in building trust between mothers and healthcare providers.
All right, we are back after that, and we've now learned something. Thank you so much, Sylvia Wanja. Now we have a question. Anasema, okay, we'll give the contact, all right? But she's saying that her blood is rhesus negative, and the husband is rhesus positive. And she's asking what she's supposed to do. We've talked about that, but maybe you can just answer them in a minute.
If your husband is rhesus negative and your rhesus, if you are rhesus negative, she's the one who's rhesus negative.
Yes.
Yes, she's supposed to be given the anti-D injection at 28 weeks. You say that's 7 months. 36 weeks, that is 9 months. And 72 hours after delivery of the baby.
Okay.
The earlier, the better.
Yeah.
Yes, so you don't have to wait for 3 days. Yes.
But you say that's for the next baby.
For
the
the
first
next
baby is safe.
The first baby is okay.
Okay.
Yeah.
And Liza, hello, can I get pregnant after delivery before the menses resume?
Yes, yes, you can. So long as our hormones have gone back to their normals.
Yeah.
Yeah, you can.
Okay.
Yeah.
We can get maybe the last question. Anasema, good morning. Yes, please, you can talk to the nurse. We'll be giving the contacts. Anasema, hi, anaitwa Sheila. Anasema, positive rhesus mom. I lost some pregnancies. Can it be that tuna differ na the husband?
No, the issue is not even with the husband.
Yeah.
The issue comes to the husband if you're rhesus negative. And if your baby takes your husband's rhesus factor.
Yeah.
Yes, but in some hospitals, not in some hospitals, there are tests that we do. Once the baby is born, we take direct blood from the baby's umbilicus and we test. If the baby has the blood group for the dad, which is positive, we give the anti-D to the mother.
Okay.
But if the baby is having your blood group, we don't need to give you. We don't need to give the mother the anti-D.
Yeah.
Yes.
Okay.
But because not in all hospitals you'd have the facilities of doing the test, it's called Coombs test. We would rather be safe than being sorry after some years.
Yeah.
So that is why we still insist that this anti-D has to be given to mothers.
Okay.
Because not in all hospitals they have the facilities to do the Coombs test.
Okay.
Yes.
But for Sheila, she's rhesus positive, which means for her she's safe.
She is okay.
She's okay.
Yeah.
Okay.
Yeah.
I see. Now, in the interest of time, we might not be able to answer all questions, but we'll be giving you contacts as you wind up, and I know that would be really nice. Now, in general, what is the role of the postnatal care for the baby? We've talked about the mom and why it's important to take care of the mom and to get the checkups for the baby. Why is that important?
It is important because of the babies also have their complications.
Yeah.
We are doing physical assessment of the baby at birth.
Yeah.
We want to see if there are any abnormalities. Yeah, there are babies who have issues. There are babies who can miss some of the organs without us knowing.
Yeah.
The mothers will only realize at home after a few days that my baby has not pooped since they gave birth, they were born. So you'd realize that maybe the anus is still closed. So some of the abnormalities, we are detecting them on physical assessment at birth.
Yeah.
Yes, and some of the complications might not come immediately, but after some days, after delivery. That is when you realize, oh, this baby is developing yellowishness, or baby is missing this, or the baby has this.
Yeah.
So it's a way of detecting complications and making sure that we discharge these mothers with healthy babies who are not going to die when they are at home.
Yeah.
And so sometimes when they have delivered, before they go, they are also given health talk, how to take care of the baby. Because if you discharge me and I'm a first-time mother, I don't even know that babies are supposed to be bathed.
Yeah.
I'm going with my baby for 6 weeks without bathing them because naogopa atakuwa na pneumonia.
Yeah.
you've not even told me how to clean the baby's umbilical cord. Naenda, that is a portal for infection. Narudi after 2 days, mtoto wako na issues. So during even this time that we do physical assessment for the babies, we teach the mothers how to take care of the babies and to detect any complications that might arise and what to do at what time.
Okay.
Yes.
Yeah, that's very important. Mom was sharing with me about her first baby and how that can be very confusing.
Stressful,
Very confusing for a first-time mom. So, yeah, that's very important. Also for the first-time moms, don't leave the facility without knowing what to do. Yeah, it's also your responsibility to ask the questions that you know you need to ask.
Walimu wako wengi hapo nje.
Sindio?
Walimu wako wengi.
People say no.
Madaktari wako wengi.
That's very true. So make sure that you get well educated in the facility before leaving.
And hata sahi ukiangalia Nakuru County or even other counties in Kenya wameweka prompt texting. You register the mother, she's able to ask any question that awezi uliza. Kama akona simu anaweza uliza na ajibiwe. So it's also another way of educating these mothers through phone messages, and it's a free platform. So anaweza uliza swali na ajibiwe. Kuna nurse online atajibiwa. Kama ni kuingia hospitali arudi alete mtoto.
That's nice. That's really nice. So where can the moms, because I know there are moms who are watching and they're like, that's good. So how would they go about it if there's a mom who will need to text?
Waende tu kwa any government hospital. Not even government. Sai kwa hospitali yoyote. They will enroll them for the inquiries. Inaitwa prompt messages by Jacaranda Health.
Okay.
Wataenroliwa. Once wamekuwa enrolled, they are now able to be answering the questions. Mtoto yangu kama pregnant woman, is this okay? Na hao watawajibu tu at any time.
Okay. What would you tell the fathers who are listening to us? Anything about maternal health?
To support us as mothers. Actually, we even encourage them to bring the mothers for antenatal clinics. Na wakikuja tunawapea first priority because tunajua pia hawataki kukaa kwa hiyo laini ya wamama wengi wanachoka. So let them also able to, unajua si uliniambia jana unasikia hivi, kwa nini usemi? So they support us, we bring up these healthy babies, we reduce the rate at which mothers die, because kama wewe ndio unakaa na mama most of the time, you'll be able to realize huyu mguu yake inafura asubuhi. Unaona? Huyu anasemaga kichwa inauma. So let them support us to help us bring up a healthy nation with healthy babies and healthy mothers, so that we can take care of our babies in years to come and give birth again and take care of them. So let them support us. Yes.
That's something you've mentioned, and maybe that's very important to talk about. For the mothers, ukisikia uko na headache, should that be a danger sign?
It is a danger sign in pregnancy. Headache, too much vomiting, kizunguzungu, blood vision, hizo zote. Those are epigastric pain, unasikia uchungu hapa. Kuja we kuja as many times as you want. Kuja tu. Hatuta kufukuza. Tutasema, huyu baba amekuja sana, lakini tumekwambia hiyo si shida. Yes.
And you're safe now.
You're safe. Because zile kichwa inauma, it might also indicate that maybe your pressures are high. So afadhali ukuje tukupime mara 100, lakini tumekwambia pressure iko sawa, enda kunywa maji pumzika.
Okay. And it's important to take care of your baby.
True.
Okay. Anoliza, if your blood group O, which is your resistance factor?
Okay, blood group, we can have a common blood group. Naweza kuwa O, but sasa hiyo rhesus ndio iko tofauti. Rhesus inaweza kuwa O positive, kuna mtu pia anaweza kuwa O negative.
Okay. Now, what would be your parting shot on everything that we've talked about today, everything prenatal, postnatal, you know, the maternal time, kwa pale?
I would just encourage pregnant women and just mothers generally.
Yeah.
Tujipende tu. Let's love ourselves. As in, when you're ukiwa na mimba, we as venye nasema, kuja hospitali kama unaona iko na kuna shida.
Okay.
Jipende. Because once you're pregnant na uko na shida na una assume it will affect your baby.
Yeah.
We might lose you and we might as well lose the baby. So tujipende. We start our ANC clinics as early as we can.
Yeah.
Now the lab works ama the tests that we are advised to do, let us do them. Be very very involved in your care.
Yeah.
Some of these mothers, they have the books. Venye ametoka clinic, anaweka kwa mfuko, anangoja next month.
Yeah.
So ajui hata kama huyu mwenye aliniatendia, did she even do the right thing? So this is a way of loving yourself.
Yeah.
Kama nimekuja clinic na sijaona kama nimehudumiwa vizuri, kwa nini unyamaze? Go through the book, get informed.
Yeah.
Jua nafaa kupimwa pressure. Kwa nini leo nimekuja clinic na sijapimwa pressure? Nafaa kushikwa, mtoto anafaa kusikizwa. Kwa nini nimeenda hospitali na mtoto hajasikizwa? You see, that is a way of loving yourself and your baby.
Yeah.
So we should also get fully involved in care of ourselves during an ANC and postnatal care.
Okay.
Yes.
Okay. Perfect. So the people who'd want to reach out and get more help, ask more questions, do you have a contact, or how would they be able to reach you?
They can use my phone.
Yeah.
My phone number.
Yeah.
And tulisema nafanya free area. Hospitali ya Muni.
Yeah.
Night Health Center.
Yeah.
I work there. I attend to antenatal mothers and postnatal mothers.
Okay.
So my number is 07 08 93 93 59.
Okay.
Yeah.
If you can take it again.
0708 93 93 59.
Perfect.
Yes.
All right.
And then you can also get me at free area. Hapo kwa hospitali tu.
Yeah.
Yeah.
Umesema ni pale Muni.
Muni tu.
Yeah. Okay. Perfect. So I know that you'll be having the contacts on your screens in a very short while, and you can always call, and I know that you will get the help that you need. Thank you so much for being here. Maybe you can take the number again. You can just repeat the number. See the people who are asking for it.
0708 93 93 59.
0708 93 93 59. Surely, it's very easy. Tunaweza itumia kama 911. Anytime you need, quick, fast. Yeah, so I know that you'll get it on your screens, and that would be great. Thank you so much for being with us today. We've learned so much, and I know all the questions that you had right from last week while we were talking about Malezi Bora, and you asked every month. Last week you had someone who asked, we have to go to hospital every month? Every month? And the baby is already here with us. But now we know why you need to, and that it's important, not only for the baby, but for you as the mom as well. Yeah. So postnatal care is very, very, very important. And thank you for making that clear for all of us, and for encouraging the fathers to also be part and parcel of the whole journey, and to help the mothers, even to support them because of their mental well-being, which is very important. So thank you so much for that session.
Thank you so much.
Yeah. Asante sana. Asante. Now, we'll be getting the Did You Know segment, and then we'll be coming back to read some of the pointers, and Brenda will be helping us go through it. But before we do that, let's get the Did You Know segment, just to jog our minds kidogo, and to be able to make sure that you get to think about something else. I know we've had a very heavy topic, and of course very informative, but the Did You Know segment helps us to just jog our minds kidogo, and then we'll be coming back to read the pointers to see what is your take home. Yeah? So let's get the Did You Know. Perfect. Our Did You Know today is that, did you know that there are more bacteria in your mouth than people on earth? Did you know? I mean, we brush every day, like twice, or some people thrice. What do you mean? There are more bacteria in your mouth than people are. But there are good bacteria as well, yeah?
Yeah.
Yeah, so could be. Could be. Never know. So go and research more, so that you'll see if it's true, and maybe just to know what the exact rates and be able to have the right statistic. Yeah. Now, we'll be having Brenda, who will be taking us through the pointers to get to help you just learn what are some of the things or what are the pointers that you get. You know, we say that every time you have to at least get 1 or 2 things that you've learned from today's show. Here's the cut that when you've not learned anything, surely. So we'll be having Brenda, who will be taking us through the whole show from we started. We say that we started off at 7:30. We had some music. You got to, you know, enjoy some music here and there. And at 8, we kicked off, started the discussion, talked about how the pregnancy journey is, mpaka sai. Yeah? And now, we get to learn from today's conversation, what is your take home? And I see we have people who've gotten back and they've said what they've learned, and maybe we'll make this very intentional. Yeah? So tukimaliza show, we'd love for you to tell us, what have you learned from today's show? Okay? And maybe if you're able to do that, start over from today, but tunaanza kuzisoma next week. Okay? But start over. You'll be telling us, what have you learned from today's show? Literally in every show that we've had. Just tell us one thing that you've learned, and that will be very important. But for today, Brenda will be taking us through. I hope you ready. Okay. Sawa sawa. So Brenda will be ready in a very short while, and she'll be telling us what she's learned from today. And maybe just a run through. Let us get it. I see you have very many people who are asking about the rhesus factor. Is it how common is it?
Okay, it is not so common, but at least on a normal ANC visit, you'd get out of 20, at least you'd get 2 or 3 mothers who are rhesus negative.
Yeah.
Yeah.
That's a
better
number.
The issue with rhesus negative, most mothers are not informed about it.
Yeah.
So sometimes you tell them the importance, and they become hesitant. Yeah. So it is something that I guess we need to focus more on, because it's serious. Because if you only have a child and you're losing the others, or others are coming with complications, it's not a good thing.
Yeah.
Yeah.
Okay. You mentioned about bleeding, and I know we'll be getting into the pointers. I know they're ready, but maybe in just a minute or less. There's a mom who's asking, what could be the problem in that during labor period you start bleeding?
You start bleeding during
the
labor
time
period that you're it could be because of detachment, or actually during delivery you're supposed to bleed, so long as it's not a lot.
Yeah.
But most of bleeding, excessive bleeding, is coming in when you're having a rupture of the uterus, or even when you're having tears during the time that the baby is being delivered, or there was a cut that was made, or there were some tissues that are remaining. It will cause a lot of bleeding.
Okay.
Yeah.
Okay. I see you have questions, but good thing you've given the numbers, so I know that they will reach out.
It's okay.
And you promised them that they will get help.
They will.
Yeah?
They will.
Okay. So let's get to go through some of the pointers. And today we're talking about antenatal and postnatal care. Dr. Lita, A and C. Yeah? Yes. So let's go through it. And we have Brenda, who will be taking us through that. Brenda, karibu sana.
Hi.
Thank you so much. I'm fine. How are you?
I'm good.
I'm good. You've learned?
Yeah, I've learned a lot.
Okay.
But I had some prior information before all of this.
Okay.
I actually did home science in high school.
Oh, really?
Yeah.
Okay.
So we learned about prenatal and antenatal care.
Okay.
Yeah.
Okay.
But just a general comment.
Yeah.
Motherhood is really scary. So our mothers, our mothers have, they have.
I've had
they're
many
warriors.
people say that. Yeah.
Yeah.
I've had many people say that. Have you had that where people say that motherhood is scary?
Yes.
Yeah.
But we have to go through it.
Yeah.
We need children.
Yeah.
Yeah.
And maybe I have some good news for it before Brenda comes in. So yesterday, and I know I've mentioned these, yesterday I was having a conversation with a mom and a group of people. And the conversation was so wholesome, and I learned quite a lot from that. And the mom said that for her, she doesn't have crazy labor pains. You see how we talk about labor pains and all that, and that's and that's why we have many young people saying that motherhood is crazy and it's scary. Is there a percentage of people, she's a unique kind of person?
So you see, when you don't also go through the normal hours in labor, it's a problem.
Why?
Because if you deliver in 30 minutes, that's a problem.
Why?
Because you'd injure the baby. Imagine if you go through that process without that preparation and all that, and it finds you maybe in a matatu or you're walking. What will happen if you deliver in 30 minutes? So that's also another problem. We are calling it precipitate labor, which can also lead to postpartum hemorrhage again.
Oh, really?
Yes. So maybe if she says that she doesn't feel any pain, but she goes through the normal labor is okay. You see, what brings labor is the uterine contractions. And the uterine contractions are the ones that bring the pain. Maybe let's say she has the uterine contractions, but her perception for labor, her perception for pain is very minimal. That is good. But delivering very fast, it's not a good thing. It's called precipitate labor.
So what's the normal time for labor? What's the normal period?
At least for first-time mothers, we're giving them up to 12 hours. 8 to 12 hours. Yes. 12?
We're talking about a whole day.
Yes, a whole day. Or even 8 hours. We have to monitor labor. Or else maybe you started laboring at home, then you come to the hospital when you're almost. You see, that's different from someone who did not feel any pain, then they suddenly, we have our baby here. So it depends with the perception of pain. The way we feel pain might also be different. That's why she feels she's lucky.
And also for the 12 hours, it's not like painful labor for the whole 12 hours,
it comes in progress. It's a process. You have mild, moderate, then severe when you're almost delivering.
I hear you. Brenda, take us through the pointers.
Okay, for today's pointers, we actually learned a lot from Rachel and Mr. Arsenal. But for me, in case you forgot some of the points, just to remind you, here are our pointers.
And maybe, sorry, Brenda, as they go, so we'll be reading some of the pointers as your mic itengenezwe hapa na pale. Tunasemanga, you've had how parents love to say, imetengenezwa na mikono ya watu before you travel and they bring for the cars, imetengenezwa na mikono ya binadamu, so we'll say the same today. But, as Brenda, her mic ikitengenezwa hapa na pale, we'll go through some of the pointers. And the first one, maybe I'll just get to know when her mic is okay. And the first pointer we are having today is that women should go for antenatal care once you know that you're pregnant. Immediately, you know that you're pregnant. So make sure that you go to hospital. And the second one, Brenda?
Avoid strenuous activities while pregnant. So it's okay to exercise, actually, to wash dishes and that kind of thing. But strenuous activities like kulima, as we have said, you should avoid that for the safety of your baby. And the next point, an expectant mother may face complications during pregnancy. And that includes hypertension, diabetes, depends with your teacher, of course, diabetes or diabetes mellitus, and bleeding. That's why I've said motherhood is really scary. And the next point, pregnancy affects mental health. And if not taken care of, it could affect the health of the mother. It all starts with your brain. So, and we have said that this can continue even to after the delivery. If the mother does not take care of her health, it might affect her and the baby, of course. And next is postpartum hemorrhage is dangerous to the mother. That is excessive bleeding. So if...
So you said it's postpartum hemorrhage?
Postpartum hemorrhage. it's dangerous to the mother. That is excessive bleeding.
Yeah.
So if a mother bleeds, it can even lead to death. So that's why a mother should go to the clinic every once in a while to check on her health and that of her baby.
Yeah.
And the next point is a mother should go for postnatal clinics for a minimum of 6 weeks, that is after she has delivered.
Yeah.
So she should go check on her health.
Yeah.
If the healing is okay, that kind of thing.
Yeah, but you said it's a minimum of 6 weeks.
Yeah.
Could go to up to
6 months.
6 months, yeah, depending on how you're healing as well.
And next, babies can also have complications after delivery, for example, jaundice. Yeah, that is what Dr. Arsenal and what I got from your discussion with Dr. Arsenal.
Okay.
But it's okay if you got something extra that I didn't mention here.
Yeah.
So yeah.
Okay. So what's something new that you've learned today? What would you say is something that you had never had before?
Something I've never had before, the postpartum hemorrhage, of course.
Yeah.
I didn't hear that before.
Okay.
And then the amount of time a mother should go to clinic, I didn't know that.
Yeah.
Yeah.
After delivery?
After delivery and before.
Okay.
As in during the pregnancy.
Okay.
Yeah.
Okay. Perfect.
Now, wait.
For me, something new that I had never had before. I would say the number of times the mom should go to hospital after delivery.
Okay.
Yeah, because I think for most mothers, we would say, as long as uko sawa. Yeah, could be even once. Ukitoka hosi, that's just it. Once you're home, wewe pabada. If you have a problem, you'll go to hospital. But the fact that you said it's very important to keep going to hospital just for checkups, hata kama una feel uko sawa, that's new. That's very important. And I'd push it to all the mothers as well. If you just gotten your baby, please go to hospital and make sure that you're okay. Yeah.
Na hiyo jua tujahesabu the immunization schedules for the baby too. Mtoto anafaa pelekwe clinic mpaka afikishe 5 years.
Kwanza 5 years.
But I know we all stop at tunapeaga break hapa 9 months, tunapumzika tena, tukifikisha 1 year and a half tunarudi tukimalizia. But ideally it should be up to 5 years.
Yeah, so every month.
Every month, 5 years.
Okay, okay. Brenda, did you know that a mom should take the baby to hospital every month up to 5 years?
After 5 years?
Yes. Yeah. After 5 years.
Bila thinking ni up to 2 years.
For real, 5 years.
To 5 years every month. I don't
Never
think our
had.
mothers even did that.
They don't.
They don't.
Sinakwambia watu wanashika break hapa na 1 year and a half.
Yeah.
Mtoto akishapewa chanjo, they get
Ndio
lost.
Okay. Perfect. So that has been it. Brenda, thank you so much for taking us through what you've learned today.
Okay.
I know that was very important for all of us. Yeah. And I hope that you've all learned at Sisi hapa in studio. Sindio?
Yeah.
Perfect. Thank you so much for staying. This has been Afya Clinic. We've been here since 7:30. I know that you've enjoyed some music, you've enjoyed the segments that you've had, and also the discussion that you've had. Thank you so much for staying. We say that this is where we transform lives by the grace of God, and this is in every form possible, teaching you about what you need to know about your health. Because, you know, as much as we say that our God is a healer and we pray for good health, is that He's given us doctors who would be able to walk with us the journey when we're not okay and when, as mothers, we're pregnant. So that is why we have these discussions every Wednesday. So thank you so much for staying. We'll be seeing you on this particular show next week on Wednesday, same place, same time. So I hope that you'll be here. But even as you wait for next week, please take care of yourself. Take a healthy, well-balanced diet, take water, exercise, rest. It's very important for yourself and for the people who are surrounding you, for your family, for your babies. It's very important. Sawa sawa. My name is Rachel Kahugo. Make sure that today you watch the lunch hour. It's very important as we talk about our physical and our health. It's also very important for you to take care of your spiritual well-being. So make sure you lunch hour from 12:30 to 2:30. All right? But until then, God bless you. God be with you. Have an amazing rest of the day. Bye-bye.
Thank you.